This conference will now be recorded.
Okay, and I guess that's my signal to welcome everybody to this webinar organized by Health Valley, Dynamic Health Systems and Iquality. My name is Koen, and I'm just starting up this webinar and possibly be your host later on. But for now, let me start by saying that I would kindly ask all of you to put your audio on mute and your webcams off, but that's already the case, so let's keep it that way. If there are any questions, please do that via the chat function. There will be people in the background answering your questions and possibly bringing them in. Leonie, you just put your webcam on now. The request was to put it off if you could, but if that's not possible, we might enforce it. I think I will give the word to Shahid to start with the introduction of this webinar, and I wish everybody a lot of fun and good luck.
Thank you very much indeed. Welcome to each and every one of you. It's a pleasure to have this opportunity to speak to all of you via this webinar about a very important topic, which I believe is majorly sort of transformational for healthcare in the world. And as someone who's been working in the health sector for at least 28 years now, and also a professor of digital health, I think this contribution that we're going to make today, I think you'll find it not only interesting, but something that's particularly valuable. What I want to do is, the agenda today is really for me to give you some kind of history and also the backstory as to how we created a patient engagement and integration platform called VitraCare. That's Dynamic Health Systems, and I explain that. And then I'll pass on to Roelien, who's going to talk about the personal conversational user interface and how the kind of collectively working together we've developed that. And then I'll present some case studies which will show how this type of transformation by working remotely and engaging with the individual can make a big difference. So I'll get started on my side of the story. So next slide for me, please. So this actually goes back quite a long time. I've been interested in the whole area of personalization of care, engagement with patients for a long time. So I work as a general practitioner, and the picture that you see there is of my practice. We are on two different sites. It's practice which is located in quite a deprived area. And back in sort of 2010, I started to work differently with patients, thinking that, if we could really engage with patients differently, what difference would that make to the way that they look after themselves and their outcomes? And what we found was something quite phenomenal, because even doing it on paper and working with patients, allowing them to be able to set their goals and action plans to be able to achieve their goals, we found that our practice was actually outperforming many of the other practices in the deprived areas, and was actually in the same category as those practices in the affluent areas that were doing exceptionally well with well-read patients and people who are very much in the know. And so that immediately kind of led us into this idea of, engagement with patients makes a big difference. So next slide, please. And also back in 2010, you will see that there's a TV camera there with my colleague on it, Dr. Richard Pope, who's a secondary care consultant, diabetes consultant. And he was doing telemedicine consultations. And we started doing, Richard is a guru of telemedicine, and he started telemedicine over here in the UK. The wonderful thing is he was doing it with people in prisons at the time, because prisoners didn't want to come out and were not really allowed out of prison to go to see to their health. So he would provide telemedicine services into prisons. And of course, that started to expand into the provision of healthcare and telemedicine to other areas, particularly, for example, in chronic disease management in care homes, and in a number of other areas, which I'll talk about. But that was going on at the time, and the wonderful thing is that we set up a hub over there at the time, and we set up a hub in Airedale Hospital where he works, And the picture that you just saw earlier on the right-hand side was a picture of the health secretary. If you could just go, that's a picture of Jeremy Hunt, who was a then health secretary, who came to see this wonderful setup of telemedicine, which was breaking ground and innovative at the time. What we found, next slide, please. What we found was that when we started to do telemedicine consultations, we actually managed to drop the number of people going to accident and emergency. And you can see on that graph that as time progressed and people were using that service, we began to see this reduction in the number of people going to A&E and therefore getting admitted into hospitals. So we knew, even then early on, that remote care, remote management of patients is actually fundamentally not only doable, but is definitely something that can transform care and make a big difference to the overall population. But we also knew something else. And Richard sees this on a daily basis, and I saw it on a daily basis in primary care, where we saw a lot of DNAs, or do not attend, where people were unable to attend appointments or could not attend appointments or did not attend appointments. And we found that there were a lot of DNAs, and that was costing the health service an awful lot of money. But when you started to do care planning and when you started to enable the individual to set their own goals and actions, guess what happened? The DNA rate actually started to come down. So we did know that, we can actually transform care with this integration of care and starting to think very seriously about remote working and personalization of care. Next slide, please. And the other thing that I learned, so this is me working in the practice, actually doing telemedicine consultations. There's a patient on the right-hand side called Sheila, who's a wonderful lady at the time in her 70s, who managed to, through care planning and using VitraCare, she managed to completely sort of change her status, health status. She's still alive today, bless her, doing very well. But what we realized was that in actual fact, this was applicable across the board in long-term conditions. But in order to be able to do this, we really needed a digital solution. We're not going to be able to deliver this on paper. It needed a digital solution and an engagement process and an integration process, which would really begin to transform healthcare and engage the patient. So we wanted to do that, and we tried that out in a number of different areas, which I'll speak about a bit later on. And that picture just shows me doing a video consultation into the care homes. And we started doing video consultations. We were the first practice in the UK to start doing video consultations into care homes. And I will speak a little bit more about that a little later on. And here we have the health secretary, who's particularly back again to look at VitraCare in relation to palliative care, and I'll speak about that a little bit later on. So a great deal of interest from the national team about the work that we were doing. So we then set to address this challenge, and you will know, I don't need to tell the people in the audience, that long-term conditions are increasing. But of course, we also know that care is fragmented and care isn't as smooth as it needs to be. And that's not simply a problem for Europe, it's actually a problem for everywhere in the world. So we decided that as DHS, we were going to really try and address this challenge of fragmented care and also looking at managing long-term conditions and the introduction of engagement to enable that to happen. And we know that there's plenty of research which actually shows very clearly that if you actually engage with the population, guess what? You spend less money and actually get better outcomes. So the national spend, the GDP spend on healthcare goes down the more you engage with patients. A very important point. I'll come back to that later on. Next slide, please. And of course, the burden of long-term conditions isn't going away. We're seeing that 73% of people right now who die as a consequence of long-term conditions. And the population is growing, and we will grow. The number of people with long-term conditions will continue to grow, whether it's in the Netherlands, whether it's in Belgium, France, anywhere, whether it's in Africa, we will get the same sort of picture. But the interesting point to make here is that within Europe, the whole world is looking at Europe because we've got the greatest rising population in long-term condition population. And the reason for that is that we actually provide very good healthcare. and because we provide very good healthcare, that enables us for people to live longer. Now, we know that we need to head in a particular direction. You know, we're going towards this idea of patient-centered care, integration of care. We need to do all of this, and we recognize, as you can see, even some of the research programs which are put together across the whole of Europe are designed to do that. However, we've kind of done it in very piecemeal. We haven't really kind of looked at it in great deal. And Reid Derrida, who you probably will be familiar with, and he's now become a bit of a friend because I speak to him relatively regularly. He's got exactly the same sort of idea that we have, and that's one of the reasons I actually connected with him. That really looking at how do we build this value-driven healthcare through engagement with patients and integration of care and enable well-being in that kind of way. So that is something we know we need to head in this direction. We know the writing's very clearly written on the wall. The question is, how do we get there? And I want to be able to share with you what we've done, which will help us to get to this particular point. Next slide, please. And then, of course, this happened. And guess what? We've actually got to the stage now where complete transformation of healthcare has happened because of coronavirus. And so despite all the policies that we've put into place in the UK, and despite all the documents that I've written, and despite all the talks I've given and everyone else, and the teams that have given trying to get people to transform the way that they're working, particularly my colleagues, doctors in the UK, guess what? COVID's come along and it's completely transformed healthcare. And the interesting thing about that particular slide is that you see that the impact is not just from the virus. The impact is also on the fact that nothing is going on within the hospital environment and people's operations are being cancelled. I know for in our case here, when the practice was closed down, patients didn't come because they were too scared. And so therefore, all those patients that we would normally be sending into hospital, referring them in because they were ill or needed urgent care, they just didn't engage with the services. So the death rate kind of, impact has gone up. No operations going on, impact has gone up. And of course, people in care homes who need chronic care and need to be looked after are not being looked after in the same way. So you can see how it impacts greatly. But the biggest thing on that particular slide, I think, is the impact on mental health. And I am seeing that. I still work as a GP day in and day out, and I see patients and I speak to patients. And the interesting thing, I believe that the impact on mental health is going to be somewhere between 30 to 40%. So it's going to be a huge impact on people's mental health out of the fear of getting coronavirus, the impact on people who've already got existing mental illness, and of course, the impact of lockdown. Next slide, please. And of course, this is a slide to laugh at. Who changed it? Was it all of those policies, or was it the chief exec or the CTO of the company? Of course not. COVID really brought about this digital transformation. Next slide, please. So this is a slide which actually McKinsey's have done some work, and it really shows that people are now recognizing that remote working is very much in the frame. It is something that, not only the patients and the population are recognizing that they're more willing to use it, but of course the providers of healthcare, people like me, doctors and so on, are also recognizing, are seeing that, this is the way that they can work and we can actually utilize that. I have personally seen that across the health economy that I work in, that people have now started to embrace this and recognize that this is the way forward. Next slide, please. So the impact on COVID and the lockdown on healthcare, this is just a summary slide I put together to just kind of point out that before COVID came along, there was massive demand. Everybody was stressed out. We were all working very hard to try and manage the demand, increasing skill mix, trying to do whatever we could. And then COVID comes along and shuts everybody down. People have got this fear. The whole sort of NHS comes to a standstill. The focus is very much on dealing with the virus. And then there's this kind of feeling from the whole sort of all the doctors that I speak to now, and whether we look at the primary care networks or whether I speak to hospital colleagues, all of them say the same thing. We don't want to go back to where we were before. We don't want to be in the situation where we were completely out of control and we were on our knees and we couldn't manage. So there is a new normal that we need to kind of create now, and we have the opportunity of doing that. I believe it is entirely in our gift to do that, and we can do it through digital health techniques. So I think the opportunity to be able to improve the outcomes, improve patient experience, get the engagement right, work in an integrated way, all the things that I've been talking about are the things that we really need to put into place. And I now want to move on to some slides which will help you to understand how we can begin to do that. Next slide, please. So we really have to change the way that we're working, and we recognize that there's a big difference between the demand out there and the provision of healthcare. And in fact, that's now even lower with COVID-19 in place because of all the things that I've said. So we really need to bridge that, and we can bridge it by increasing productivity. Now, don't confuse productivity with efficiency, because we can increase massive activity without really impacting on outcomes. So I'm really concentrating on the area of productivity. Productivity is where it's at. We need to do that, and we can do that via this quadruple aim. Next slide. And that is really to, as you can see on there, it's about patients co-creating health, improving health outcomes, getting the experiences right, and the better use of healthcare facilities. It's within our gift to be able to do that. Next slide, please. So if we let's just look at what a patient and what are the things that we can actually change, and you can see that the health makeup of an individual, some of it is genetic, some of it's social, some of it's physical environment, obviously medical, but largely it's to do with patient's behavior. Our behavior defines our health largely. So I want to introduce you to this patient engagement and activation, co-creating health, which are key to understanding dynamic health systems and Vitracare. Because we can influence the medical side of things by care integration. We talked about how we need to get rid of fragmentation. Also, health work innovating in different ways, and that's always going on. And that's something that we can look at. Next slide. And we can influence, include the social care element. Next slide. And then we can equip the patient to actually participate fully in their care and take the lead. Next slide. And the patient engagement and activation that goes with it, enable that to happen. Next slide. And of course, include carers and co-create healthcare. So what you're beginning to see there are two things. One is the care integration and health work innovation, which is the kiwi in the fruit in the top right-hand corner, and patient empowerment and activation for the co-creation of healthcare. And that is the peach. So peach and kiwi are our key elements and services of our of Vitracare. So you can see how these two elements fit together to enable us to start to engage with the patient. Now, when I start a conversation, we can either have a very miserable conversation where the patient comes in and I say, well, your blood pressure is really through the roof, and by the way, things aren't looking very good, your cholesterol's not right, and that's not right, and that's not right. And that is actually a very depressing consultation to have. So I choose not to have depressing consultations. I choose to have engaging consultations with patients. And that is, what's going on in your life right now? What is it that you would like to truly achieve? And where do you really want to kind of get to? And then to enable the individual to try and achieve that. And by the way, when you do that with patients, guess what happens? They actually achieve 80% of their goals. So because when patients are actually enabled themselves and they really want to try and achieve something, they will do that. Next slide, please. So I hope that you're feeling pretty good at the moment and you've enjoyed that introductory section of the talk where I've kind of put it into context as to what we're talking about. I'm now going to hand on to Roelien, who's going to speak about the conversational user interface. And this is our element of collaboration with Iquality, where we've been able to truly bring about this new way of working with patients.
Yes, thank you. I hope you're all seeing my screen right now. I will continue this story today by discussing the design and user experience side of it. I am Roelien. I'm a user experience designer at Iquality, and together with DHS, we develop a platform that touches on the topics Shahid just discussed. So as we've just heard, to alleviate pressure on healthcare systems, we are working on sort of a redesign of the way we do things. The goal is to engage, to activate patients by giving them a personalized experience. By doing so, we improve supply of information, and this gives a more tailored experience to what a patient might need. So these are the three key points that we can take away from the introduction, and we're going to take on with us into the entire presentation. So in our increasingly digital world, we can do anything. We can order dinner, we can schedule dry cleaning pickup, we can order a car or control home security from anywhere in the world. This all happens at our fingertips, and that does not end at completing everyday tasks. It has also evolved the way we engage in our health, in our healthcare, and in our well-being. Digital health has been a trend for years now, and research shows that empowered patients, digitally empowered patients, are actively participating in their health, from using wearable devices and online apps to manage their care, to searching online for medical information and support. So not only is the world becoming more digital, but patients are also using this technology to empower themselves in their healthcare journey. The internet has pushed us to be information driven, and this also happens when it comes to our health. So patients are seeking faster access to information and to newer technologies, which allow them to take control of their health decisions. So patients are educating themselves about their health needs, but they're also becoming increasingly self-reliant when it comes to their health. With the explosion of wearable options and innovation in apps, websites, and other platforms, patients now have an arsenal of tools enabling them to track and quantify their health. What we need to do is address the problem. What is the problem? That systems are not designed for one patient, but for a large population. Platforms are often not personalized to the patient's journey. What we see right now is that existing apps and websites often fail to address the issues that matter to patients and fail to feel relatable. So to create relevant online health, it is critical to shift to a personalized, patient-centered design. Now, more than ever, patients are at the center of their healthcare journey, having access to all these different sources. Can be healthcare professionals, online search, wearables, mobile apps. What we need to do is to continue to adapt to this newly empowered patient. So people are becoming more digital and are looking up information online constantly. What we need to do is be proactive and innovative in how we satisfy their hunger for information almost. So healthcare should no longer be a one-way conversation where you just present information you hope people might need. Patients are looking to engage and to take a better stand for health, and we can help guide that two-way conversation. So this is just a little bit about what's the problem right now, what do we see, and what becomes clear when looking at this situation is that there are a plethora of platforms and sources that don't work together. So we need to put the patient at the center of their healthcare journey, but what we do is put a website online, maybe have an app to track their health data in, social channels to keep them updated, or a My Domain where they can view personal information. And then there's all these different channels and all these different platforms that are sources of information that are fragmented. They take a lot of work to keep updated on, and that has to be done by the patient. They're not coming to you with, oh, look, I added some new information. No, the patient has to search for their information. And so we have all these static platforms that also don't work together and don't communicate. Each might contain a valuable and relevant piece of information to the healthcare journey of a patient. So instead of the platforms giving the content when the patient needs it, the patient needs to search each single one for themselves. So these sources are not only fragmented, but they also don't communicate to each other. And this makes it impossible to create something that actually helps the patient in their health journey. So what is our contribution to the solution? First of all, connect all these different sources into one environment. So you have, when you connect sources, it is possible to present the right information at the right time and to actively engage patients in their healthcare journey. So what does that engaging and activating interface look like? Well, we think it looks like a conversational one. You've heard this term a few times by now, so just briefly discussing what a conversational interface is. It is software that follows the principles of human-to-human conversation. So it's talking to a machine, for instance, and using terms like agreeing, disagreeing, messaging, or asking instead of navigating and browsing. So it's more natural and it builds on what people know and do a lot. Talk. We talk a lot. The skill of conversation is something we all have. And by using this in digital interfaces, it creates a seamless experience because there's no need to learn new behavior. So a CUI can take many forms, but it uses the same basic ideas, like what we do when we chat via WhatsApp, Facebook. It uses the same basic principles. The solution is not a conversational interface as an extra system, but as a means to present the user with information that's already there and do so in an engaging way. So we are putting a CUI between users and information. And by doing so, we touch on the 3 goals we saw in the beginning: inform, activate, engage. So what does that look like in practice when we're talking about the healthcare journey, and what do we design and develop to actually contribute to the solution? A CUI can be shown on the website and act as an assistant and present the right site content, or it can answer questions the user has or guide you to booking a course. So this touches on the inform part of the 3 goals we have. And in this case, the conversational assistant is an easy way to help you to the right content. The advantage of a CUI is that it doesn't matter on what device you're on. The user always has the same experience because you're always talking to the interface instead of navigating differently on a website or on an app. It gives you a uniform experience, and that's very important when you create an engaging journey. By connecting the bot to all the platforms, it presents the user with the same conversational interface on every platform. This can work on desktop. This would also work on mobile, but by putting data together, you can get the user to actively search for what they need instead of just presenting them with information that has been made for hundreds of people. So the same interface on a different device that has the same functions and can do the same thing, but can use different technologies to engage and activate the patient. Connecting platforms also makes it easier to activate the user to be in charge of their health. A solution like this would not only work for a general website, it can activate the patients by using the tools at hand, like notifications. By being activating, you can gather better insights in what user needs and what might help in their healthcare journey. So on mobile, we would have a conversational assistant to help you track your health or giving you a way to enter how you're feeling. And of course, notifications are nothing new, but it can be used for this very well. Because the most powerful thing is that a notification would not lead to a static web page, but it triggers a conversation. So on mobile, you can have a conversational assistant to help you track your health by giving you a way to enter how you're feeling and track your progress. But it does this by simply asking questions. And then when you answer the questions, you get a personalized response to what you need and what might be relevant for your journey. This can present the user with reminders or tools relevant to their healthcare. So by combining sources and have a conversational assistant as a common denominator, you can make your online platforms so much more relevant. Engage the user through conversation, and it doesn't matter if this is on a laptop or a smartphone, it's a uniform experience. So no matter what channel or source you have, it would be one patient journey on all channels. Now more than ever, patients need to be in charge of their personal healthcare journey by having direct access to a wide selection of different sources, but through one uniform experience. With the world being so digital and patient clients having access to content at all times, people are now looking for guidance constantly, and that is what we try to accommodate with this solution. So that was that on the user experiences side, just very briefly, and on the user side of the story. Now we're going to show you some case studies and some what this has done in practice. If you have any more questions about the CUI, I can answer them in the chat, of course, and I will give the word back to Shahid right now.
In the meantime, Shahid, I saw there was a question about if there's any scientific evidence that a CUI is better than a normal way of consuming information. Is that something that you will touch upon, or maybe could have a short answer now while Axel is trying to fix the presentation?
I think when it comes to normal conversation, a CUI is built on that type of approach anyway. So when you're having a normal conversation, the conversation isn't just simply speech. You know, it involves looking at body language and everything else. So it's a much broader kind of experience if you look at it in that kind of context. But as far as the CUI is concerned, the opportunity for certain things to be discussed in that kind of way, I think the CUI lends itself to that. And I think the research, well, a lot of the research evidence around CUIs indicate that there are certain circumstances within which they work really well. And of course, you can't examine somebody via CUI in the way that a doctor would examine a patient. Or you can't see the body language, you can't sort of get that sensitivity. However, apart from that, I think, you know, the CUI can have that conversation in a normal way. That's just like, you know, two people do have a conversation using words.
Okay, so it's really important still to have a look in what part of the whole process you will put in the CUI.
Yes, indeed. And I think there are areas where the CUI can completely transform the clinician-patient experience. And there are other areas where the CUI, you know, wouldn't be able to make a difference. For example, I'm sitting in front of a patient and I need to measure their blood pressure. It wouldn't sort of work in that kind of way, although the person could measure their own blood pressure and put it into that could be integrated into the system, which we already have right now. I'm going to show you some evidence of that. So that's just a little example of how the difference is. But say, for example, somebody wanted to make an appointment, or they wanted to get a sick note, or they wanted to make an appointment with a psychologist or so, that could easily be managed by a CUI interface. And there could be layers and layers and layers of it where patients can actually have different elements of their care. If it's their dynamic care plan, then they could be interacting with the CUI regarding their dynamic care plan. If not, it could be related to making an appointment, for example, or even working up whether they need to see the doctor or not. So I think, you know, the opportunities are immense.
Okay.
Right,
Well,
I
I
think
think
we've
that
got this.
clears it up, and good luck with the second part.
Thank you. Thank you, Roelien. That was really good. What I wanted to really do now was to talk about some case studies where we've put this into practice, and we've started working with patients to try and determine, you know, what difference does patient engagement make, and what difference does this approach, the peach and kiwi approach, make to the way in which we look after patients and the money that we save. So this slide basically shows you one of my patients actually measuring, taking his own blood pressure, doing his, we've done care planning, and he's monitoring everything himself at home. He's doing the self-care. It's just an example where he's got an integrated device that goes, the data goes straight into VitraCare, and he can see that information immediately, and he can see all of his data that is put in. What this shows is that there are, in primary care, for example, whether we look at blood pressure or weight measurement, or look at practice visits, we see that there's an enormous impact of patient engagement on the outcomes. And I remember I talked about productivity. Well, it's outcomes that are important. So what you can see in the first graph are really the improvements in weight as a consequence of the person, looking after themselves and taking exercise because they've decided they want to lose weight. And similarly for blood pressure measurements, we can see the impact that you've actually got. So you can begin to get changes in individuals, and in each individual, this is a case series of about 140 patients, where we've seen reductions in their weight, reductions in their blood pressure, and reduction in the number of visits to the practice. Remember, I mentioned that there was a big issue around demand. Well, this reduces demand. The individual, engaged individual reduces demand. Next slide, please. And of course, here's another example where we worked in a hospital environment where people had breast cancer, and they had the ability to be able to monitor their symptoms after when they were on chemotherapy. They could monitor their symptoms at home. And the wonderful thing about this was that the patients actually said, I feel as if I'm being treated like a private patient. They had the ability not only to monitor themselves, but if they needed to, they could get in touch. There could be a telemedicine consultation, and they were even monitored 24 hours a day via the out-of-hours service. So they could connect with the out-of-hours service. And these individual patients actually, if anybody knows about adjuvant chemotherapy, they'll realize that they can develop sepsis very quickly, and their symptoms can go off really rapidly as well. And they end up in hospital often, needing to stay for quite a number of days whilst they get treated. And what we found by them using Vitracare was that we could reduce the length of stay in hospital quite significantly by using Vitracare. Those that didn't use Vitracare, this was a kind of control group, we found that they were spending more time in hospital. They were not picked up early enough. They didn't get the kind of interventions that we've been talking about, I've mentioned earlier on. So in terms of thinking about Kiwi and Peach, patient engagement side of it and the patient integration, you can see how this actually fulfills the quadruple aim, and it actually enables the patient to go through the system in a less fragmented way and get better quality care sooner with the immediacy that's needed. Next slide, please. And here's another example where we've been working in end-of-life support with Sue Ryder care homes. And here, in this particular context, we know that care is incredibly fragmented and people often have a really bad experience. And people have often complained about this, and we've seen lots of documentation on people's experiences not being as good as they potentially could be. And what we found was that the ability to build an extended care team around the individual patient so that the doctor, the nurses, and whoever's looking after them, and even their loved ones, their husbands, wives, daughters, sons, etc., they could be integrated as an extended care team into using the Vitracare app. And it enabled those individuals to get a much better experience. Like, for example, there's a number of quotes on there from patients. The ability for patients to be able to tell their story so that everybody in the team knows about it and they don't have to keep repeating it. The ability of everybody knowing what's going on with that individual at any particular time. Speaking and sharing with other members of their family and so on and so forth. A really positive kind of outcome in terms of experience. And this is what the Health Secretary, Jeremy Hunt, he really liked this. This is what he really thought was wonderful about this. The ability of getting that connectedness and that extended care team, which enables the individual to go through the system in a less fragmented way, which just improves patient experience completely. Care home, this is the work that I was doing in the practice, and we started working with care homes. And what we found was something quite phenomenal. Not only could we actually address about 70 to 80% of the care homes consultations, we could do them without actually doing a visit. But the patients loved it because they got reception, or they got the immediacy. We could respond to their requests quite quickly. And therefore, the ability for us to kind of respond to their needs was fundamentally important to the patient. So the patient doesn't want to keep waiting there until we actually go and make a visit. or sometimes, you know, they end up in hospital to go to A&E and they get admitted. And you'll know that chronic disease patients, once they actually go to A&E, they end up invariably getting admitted into hospital. So the ability to be able to actually manage these patients in a successful way through video consultations was revolutionary, so revolutionary that it's now extended across the whole of our system over here, the whole of our health economy in this area, and is going everywhere else as well. And we know that during the winter, it gets even worse. And because it gets even worse during the winter, we need to try and save as much time. And in fact, this gave me the opportunity of having lunch and having coffees and teas and saving time as a clinician, which many of my colleagues were always complaining about. So also here are some other examples of remote patient care, which we've been doing for quite a long time. So this ability to do telemedicine consultations with patients who've got a VitraCare account and happen to have cancer, and being able to, you know, provide that kind of care remotely to the patient. And another one on the right-hand side is foot selfies, where the individual who may well be diabetic has got a problem with their feet, and they need to have or take a picture of that. That picture is sent through to the team in the hospital. Somebody can actually look at that and decide whether that patient needs to be admitted into hospital or whether it can be dealt with there and then, or whether they need to see somebody and an appointment can be made. The immediacy of service is wonderful. If that didn't happen, guess what would happen to that patient? They'd either end up coming in acutely and having their toe amputated, or they may end up coming acutely with sepsis and being quite ill with it. So you can see this remote care and the ability to introduce that immediacy and that integration of care that I keep talking about, and patient engagement, begins to completely transform care. Next slide, please. And we've done this now in London and also in Lincolnshire, where we're looking at much, much larger populations. So in London, we have a population of 2.4 million, and in Lincolnshire, about 1 point something million. And we've got these patients who, in London, we're doing this work on diabetes, and we've prepared a platform which has got the conversational user interface embedded in there, and it enables the individual patients to not only get educational information, but they can book courses, they can do a variety of different things. And of course, what we want to and ultimately want to do with them is to prevent the onset of diabetes. We want to, for those people who are diabetic, to be able to manage their diabetes much more effectively. Because you will know that diabetes is literally going through the roof because obesity is going up around the world. And linked to the obesity is diabetes, and linked to all of this is your behavior. So changing behavior would make a massive difference, and the evidence base is already there. In Lincolnshire, we're doing this integrated piece of work across the whole primary care, secondary care, the whole system, which is really looking at mental health and elements of diabetes and looking at heart failure. So you can see that we can not just simply, we're thinking about doing it for the individual, but we can actually scale it up to millions of patients. Next slide, please. So let me just talk about the extended care team element of it, because this is really important when it comes to the conversational user interface. So if I'm the doctor and you're the patient, then I'm talking to you, but next slide. But we also know that the patient, you are speaking to other doctors and seeing other doctors too. And of course, I have got 10,000 patients and I'm speaking to other patients too all the time. So there's the whole kind of development of all sorts of things going on, and we need to be able to kind of rationalize that. So next slide, please. So this shows you or explains to you how this can be done. So as the doctor, I can look at the patient, the health professional side of things. I can see the patient record. I'm using, you know, Office 365. We've got the VitraCare engagement platform. We've got patient data in there. We've got an area where the information is stored, which is very secure. I've got all of that. And I can actually prescribe to the individual patient what is it that they really need for their personal care. And their personal care companion becomes this app that we have and the bot that goes with it, the conversational user interface. and it's got so many different elements to it that we can actually prescribe for the individual, a bit like a treatment, and say these are the elements that you actually need. Yes, you do need the telemedicine consultation. Yes, you do need to have the ability to be able to manage your care planning and care and action plans. Yes, you do. You want to be able to book into appointments. So you can see how we can personalize care and personalize it in such a way that it takes away the fragmentation. And when you take away fragmentation, you smooth the patient journey. And when you smooth the patient journey, you improve the patient experience massively. And that is what makes the difference, in terms of being able, well, from where we are right now and where we need to get to. So it's personalizing care for the individual, but then scaling that up to the population. Next slide, please. So when you look at it in this kind of context, you can see now that the patient is at the center, and the patient is speaking to other patients, and the patient speaking to various doctors. So you've now got this extended care team, and they're working in a much more sustained conversation. So there's a network of conversations, and we're treating the individual, but we can actually scale that up to a whole population of millions of patients. Next slide, please. And guess what happens when we do that? We know you will be familiar with this type of slide. This is the Kaiser Permanente triangle. And what it shows is that the pressure and the demand for people with long-term conditions for healthcare services is literally on the up and up and up. And the higher up you go, the greater the complexity of the patients. And so what we're doing by patient engagement and integration of services in the way that I've spoken about is that we're actually transforming it and pinching the top of this triangle and pushing everything back down, because people are self-caring much more effectively. They are looking after themselves much more effectively. They have the support of their clinicians around them who are supporting them to enable them to achieve their goals and their outcomes, thereby improving productivity. And that actually pushes everything in the opposite direction, and it saves a huge amount of money. Actually, it's, we've worked out that it saves £1,000 per patient per year, which is a big saving when it comes to healthcare. Next slide, please. Now, I want to leave you with that kind of thought, because I wanted to, first of all, thank you for joining us today, but also to say that, we're here to work with you, and should any of you be interested, then please get in touch, and we'll be delighted to follow up and speak to you and tell you more, because obviously we only had 40 minutes to be able to express this and show you all the case studies, but we'd like you to be able to have an experience. And if you would like to have that experience, please do get in touch with the presenters, and we will connect you with us, and we'll be delighted to come and meet with you, speak with you remotely, and in any way that we can to enable you to understand what we're truly trying to achieve here, because I believe this is revolutionary for healthcare in the world, for the healthcare systems in the world. Thank you very much for your time.
Thanks, Shahid. Well, I think you closed the whole webinar pretty darn good, but I wanted to mention that we send an email to all the participants together with the recording of this session, so you can read and look back everything, and we will also share the contact details of the people that could tell more about the whole system and could possibly give a demo. So that will be shared with everybody. And yeah, that's it, I guess. So I will thank everybody as well. Also Roelien and you, Shahid, for your presentations, and hope to see you all in the next webinar.
Thank you.